Now we can talk about pre-made versus self-made cards. You can make your own cards. So there are two types of users: people who make their own cards, people who use pre-made cards, and both work, and context decides. If you are making the benefits with self-made cards is that there is better encoding, because it's you use a lot of personal phrasing. But the cons is that the cons are it's very time consuming and not scalable. This is best if you have long prep time and a small syllabus. Pre-made decks are much more better when, for example, you are short on time, because they are time efficient, they are comprehensive, and they are exam aligned. The cons are they initially feel very overwhelming and they're less personal because someone else makes them. But the thing is, they are best for competitive exams where you have limited time. Pre-made decks are like Q banks. You don't build them, you just use them. So when choosing a deck, you need to check for exam relevance. You need to see if the core concepts are present, and you need to understand that it does not have to be the latest, but it has to be sufficient. It has to have at least some core concepts present there, and it doesn't have to be perfect. So when are mnemonics worth it, right? We talked about mnemonics, we'll talk about mnemonics again. Mnemonics are worth it when we are trying to talk about lists, about association, about repeated facts. For example, we can talk about drugs or markers, cancer markers, or classification. And you can use this beautiful trick called visual memory. What I do is I try to turn around the shapes of things and letters and have personal associations. For example, CA15-3, this is a marker for breast cancer. Why? Because the 3 if you turn around looks like breast. And CA19-9, it is a marker for pancreatic cancer. Why? Because if you turn 9 around, it looks like pancreas sideways. For example, Cotard syndrome. Cotard ends with a D. D stands for dead, so the patient believes he's dead. Capgras syndrome. Capgras syndrome, the word cap, when you put a cap on, you feel like you're an imposter, so the patient feels like they're an imposter. So these visual memory tricks, they don't have to be elegant, they just have to stick. And you need to understand something. It's much more important to be personal than perfect. A bad personal mnemonic beats a perfect generic one every time. You need to have a personal, it's important that you trust your personal mnemonics more than perfect ones. But doesn't mean you need to go out and make personal mnemonic for everything. If there is a generic one out there, good. But if it's not there, you personalize it, because you will remember it much more than